I've been given the difficult task of presenting, for all of our sake, our community's high blood pressure collaborative, what we have achieved together and why it matters. And I think it's important that we do so because in many ways this collaborative is like the 7 blind fellows with the elephant. Each of us touch this work in a different way. And my aim is to provide the narrative that allows us to see how the part of the work that we touch fits into the whole and how the whole is greater than the sum of its various parts. So hopefully your takeaways from my presentation will be 3. An understanding of the gains that we celebrate today, an appreciation for how these gains link with the important work that you do and have been doing each and every day to make our gains not only real, but truly collaborative. And a determination to help us build a more perfect collaborative union as we set aim for the next phase of our work. And when I'm done, Tom Arnone is going to talk to you about the next phase of our work because it has everything to do with the good and the bad that is the news in this chart. As you can see by the title, this is the control rate trend and the practices involved in our community high blood pressure collaborative. And these data document that all of the efforts taking place in our community and in the lives of those who, as I, have hypertension, have combined to result in initial and statistically significant improvement. We can't tell you which piece or pieces did. We can't tell you which is the magic bullet that can make it all happen. But what we can say is that because of all of these things happening together in this community through our effort, our community's blood pressure control rate has improved from 64.4% to 71.3%. But the control rate, as you can see, has plateaued. Now I want you to know I've really been waiting since middle school geography to use the word plateau in everyday language. Our control rate progress has plateaued. And Dr. Arnone is going to tell us about that plateauing just as soon as I get out of your way. But before he does, I want to lead you on a quick whirlwind tour of some of the people and organizations that are sitting next to you and let you know how we have achieved and maintained these 5 years of improvement. To paraphrase the late Reverend Dr. King, these improvements were neither automatic nor inevitable. Every step required sacrifice, suffering, and struggle. And I'll witness it because I haven't had an Egg McMuffin in over 2 years. And it's required the tireless exertions and passionate concerns of dedicated individuals, organizations, and partners. And at the heart of our collaborative is, as Dr. Wright noted, our most interesting and unique set of community-wide, community-based health improvement partnerships, those that reside with the Rochester Business Alliance. The RBA and its healthcare planning team have proved the truth that was declared by President Truman. It's amazing what you can accomplish if you stop caring about who gets the credit. I want to affirm Dr. Wright's statement and share with you that as I travel the state and across the country with regard to community-wide, community-based population health improvement efforts, the engagement of Rochester's business community remains unique, noteworthy, and the aspirational goal of the most of the rest of America. And I hope that you note that because our public-private collaborative has been bold enough to move beyond clinical improvements to reach community improvement by exploring opportunities for systemic change, we have benefited from the visionary leadership of the RBA, of Danny Wegman and his colleagues on the Healthcare CEO Group, and of folks like John and Cindy Ledestri, who have moved from talk to action. It has to be noted that Ledestre Foods has brought to market a way for hypertensive lovers of Italian food like me to continue to enjoy pasta sauce without blowing my recommended daily allowance for sodium intake. And those are the improvements, those are the changes in the underlying environment that do much to make health management possible. My next two slides share with you the way in which our local hospitals and healthcare systems have been essential to our collaborative success. While developing, perfecting, and advancing their own institutional efforts at population health management and clinical quality improvement, we are fortunate that the leaders of our health systems and the incredible physicians and clinicians that they employ, people like John Bisignano, Mike Nazar, Tom Rocco, Nana Bennett, Jim Sutton, have given countless thousands of hours towards the success of our collaborative and the improved health of our community. The collaborative's practice improvement activities could not have been undertaken, and our community high blood pressure registry, a unique resource for data collection and analysis, could never have been created without the top-level commitment of each system to population health improvement, to supporting our collaborative, and to promoting a culture of health in the Finger Lakes region. The system's investment in care coordinators, coaches, and care managers has fueled our collaborative ability to respond to the social and economic factors that complicate primary care and health self-management. And in partnership with our local insurers, our local health systems have been working to align payment incentives with the triple aim of healthcare, which includes improving the patient's experience of care. And in the spirit of continuous improvement, our collaborative, thanks to the generous support of the Greater Rochester Health Foundation, has helped us respond to all that we have learned on our journey towards the triple aim. And we've been able to also respond to the changes in the standards of care that RJNC8 by refreshing our community's clinical care guidelines. This is an important investment that the GRHF has made because the Medical Society's important role in developing and disseminating guidelines and assisting in their implementation is an essential way in which we are making our work sustainable. But if all this were, as Melanie pointed out in her question, about the clinical world and the problems that money alone can simply solve, it wouldn't lead to transformation. Transformation comes when the healthcare world and the business world have an effective bridge and channel of communication with the community. When there's a bridge to neighborhoods, to the places where people live, work, play, and pray. And that's why we're so fortunate to have such a vibrant and innovative local chapter of the Heart Association. They've helped us involve the broader community, and they've helped us do so with ways that are provocative and fun. Whether it's been the yearly Go Red for Women Luncheon or the Rochester Heart Walk, our friends at the AHA have reminded us of our central purpose and motivation. They've reminded us that life is why. So let me pause for a moment and remind us all that we were incredibly advantaged as a community by the fact that this work of community-based, community-oriented improvement in high blood pressure control really does predate our collaborative. It's work that in many ways can be considered to have been pioneered by the Greater Rochester Health Foundation, because even before the collaborative existed, GRHF conducted a major research project and 4 medical clinics in the community around high blood pressure, work that informed many of the interventions that have followed. And John Urban and the Health Foundation have accepted RBA's invitation to become part of our collaborative and to share lessons learned and to provide guidance and guardrails. And I hope you won't mind if I pause just a little bit longer on this slide, because I need to embarrass a very dear friend, because this slide gives me the opportunity to confess that as we celebrate, not even I can come up with words to express the essential role that has been played by the Wegman Family Charitable Foundation and by Paul Speranza. The Wegman Foundation was our angel investor, and it has truly made all of this work possible. But I cannot possibly overstate the way in which Paul Speranza Jr. has been our cheerleader and our champion. In the tradition of Eastman, Wilson, and so many more before, he has been both our inspirational leader and our aspirational leader, keeping us at the table and engaged in the work by the simple force of his belief that of all forms of inequality, injustice in healthcare is the most shocking and the most inhumane. That's a quote by Dr. King. And if you ever really want to know why this is the greatest country to live in and the greatest city to grow up in, stop Paul Speranza and ask him one day to talk to you about Dr. King and what the civil rights movement really meant to this country. Good news, folks. I only brought 8 pages with me, and we're at the bottom of page 6, so I'm about to get out of your way. As I move towards my close, let me note the role of our local insurers. You should know that, as with our health systems, our insurer participation in the collaborative has shown how in a competitive environment, stakeholders can compete on things that actually matter, things that deliver value to patients and to payers. And they've also modeled just how it is that while competing, they can also collaborate to promote community-wide health improvement and to pursue health equity. Excellus, Blue Cross Blue Shield, and MVP Healthcare have done so through smart investments in case and disease management. By, in Excellus's case, promoting medication adherence, and in the case of MVP, promoting lowering cholesterol and reducing smoking. And I'll also interrupt myself here to point out how very fortunate we are to have locally focused, not-for-profit insurers who truly care about regional collaboration and support local partnerships. It is a rare thing in this country, and we need to protect it in our community. We need to celebrate that MVP Healthcare has been actively involved in designing and implementing workplace wellness programs, and that Excellus is providing support to grassroots wellness initiatives and to some of those faith-based programs that we talked about that are taking place in churches in the heart of the city. And that work in the faith community has just been strengthened with new funding from the Health Foundation. We are so proud of the work that's being led by the Interdenominational Health Ministry Coalition, some of whose members are headed off this week to represent our community at the National Healthy Churches 2020 conference in Charlotte, North Carolina. This work is such a smart and effective complement to the great health education and health promotion work that Trillium spearheads in many of our local barbershops and beauty salons. And all of this work is supported by students, faculty, and researchers like Janine who are attached to our local nursing programs. These opportunities provide service learning experiences for undergraduate and graduate students, and they give our collaborative the volunteer labor force needed to bring health screenings and health education into settings where people return time and time again. The growing Congregational Health Partnership is springboarding off of the IHMC to really expand our reach beyond the black church to engage with churches, mosques, temples, and synagogues of all denominations and faith traditions, and is aiming to expand to represent the entire region. And that regional expansion brings me to the end of my part of this presentation, as we celebrate how the past 5 years have built true partnership with Andrea Harridan and her colleagues at the SAY Network. We've expanded our data collection so that the registry now expands regionally. We have involved the 8 other regional health departments into this collaborative work. And throughout our region, county health assessments and health improvement plans are including high blood pressure, smoking cessation, and obesity. In short, all the arrows of population health improvement are being lined up to point in the same direction. But yet there's still more that we have to do. Tom?